Acute compartment syndrome, ACS, of the leg is a surgical emergency characterized by increased pressure within a closed muscle compartment, leading to compromised blood flow, tissue ischemia, and potentially irreversible damage if not treated promptly. Here's a detailed breakdown. Nash-Shap, Anatomy and Pathophysiology. 1. Compartments of the leg. The leg is divided into four main compartments: anterior, lateral, superficial posterior, deep posterior. Each compartment is enclosed by fascial layers that are relatively inelastic. 2. Mechanism of ACS. ACS occurs when increased pressure within a compartment exceeds the capillary perfusion pressure. This leads to reduced oxygen delivery, cellular hypoxia, and eventual tissue necrosis. Causes: 1. Trauma, fractures, especially tibial shaft fractures. Crush injuries, penetrating injuries. 2. Iatrogenic causes, tight casts or bandages, surgical complications. 3. Other causes, burns, snake bites due to venom-induced swelling, vigorous exercise or overuse, rare. Tash-Shar, clinical features. 1. Pain, severe and out of proportion to the injury, worsens with passive stretching of the muscles in the compartment. 2. Paresthesia, tingling or numbness due to nerve compression. 3. Pallor, pale skin due to reduced blood flow. 4. Paralysis, late sign, suggests irreversible muscle and nerve damage. 5. Pulselessness, a very late and unreliable sign. Pulses may remain palpable due to arterial flow. 6. Tense, swollen compartments. On palpation, the affected compartment feels firm and tight. Diagnosis. 1. Clinical diagnosis. High suspicion based on history and physical exam findings. 2. Measurement of compartment pressure. Normal compartment pressure, 10 mm Hg. ACS, pressure 30 mm Hg, or a difference between diastolic blood pressure and compartment pressure, delta P, of 30 mm Hg. 3. Imaging. Not diagnostic, but may help identify underlying fractures or other causes. 1. Surgical fasciotomy. Emergent decompression by making incisions in the fascia to relieve pressure. Delayed or inadequate treatment can lead to permanent damage. 2. Supportive care. Removal of constrictive dressings or casts. Elevation of the limb slightly above heart level to reduce swelling. Complications. 1. Irreversible muscle and nerve damage, leading to functional impairment or paralysis. 2. Rhabdomyolysis. Breakdown of muscle tissue causing myoglobin release, potentially leading to kidney failure. 3. Limb ischemia may necessitate amputation. 4. Chronic pain and dysfunction as part of a post-compartment syndrome. Prevention. Proper management of fractures and injuries. Avoid tight casts or bandages. Early recognition and intervention. Acute compartment syndrome is a time-sensitive condition, and prompt surgical intervention is crucial to prevent devastating outcomes.